Hello and welcome back to my channel. My name is Nick Bankhead and I'm a D1 at the University of Utah School of Dentistry. We just started our summer semester and finished up with our spring, and I'm really excited to talk to you today about the spring semester, how it went, give a recap of the different kind of classes we took, the total amount of credits, and what to expect if you're a student or a pre-dental student interested in attending the University of Utah School of Dentistry. So let's get into it. So in our spring D1 semester at the University of Utah, we took a lot of classes, as you can see on this board. I wrote out all the different courses we took and their corresponding credit loads, and the total amount of credits is 29. Now that sounds like a lot, and to be honest, it was a lot of credits. However, some of these classes are broken down into a first and second block format. So some classes you finish after about 8 weeks, and other classes you start after about 8 weeks, which makes it really nice because it gives you a change of pace in the middle of the semester, and I really appreciated that. So for example, our oral radiology and our oral radiology lab course we had on Wednesdays. Now after that finished up, we started actually assisting in clinic on Wednesdays. So it was really nice change of pace. It helped us get some experience taking radiographs and getting comfortable doing PAs, FMX, bite wings, things like that, and then transitioning into applying those skills into clinic. So oral radiology, great class. I really enjoyed it. I felt that with some experience, with some assistant experience before, I had a good idea of what it was like to use a wall-mounted unit versus a nomad or a handheld unit, how to use digital plates. We used our digital sensors. We learned like the whole history of radiology, got into phosphor plates, all the way up to digital scanners and things like that. So it was a good whirlwind tour of the history of radiology and why we do the things we do. And it was really good. It was really good to learn about the principles of ALARA and when and why we take dental radiographs and how to keep the amount of radiation the patient's exposed to a minimal, and how to protect ourselves and our future staff. Perio 1. I really enjoyed this course. As someone who's interested in specializing periodontics, I took special attention to this class and tried to stay up to date on my Anki as much as I could. Perio 1 was really fun because we went over a lot of the biology behind the periodontium, talking about the different cells, the different environmental factors that lead to gingivitis and then periodontitis and other periodontal conditions. And I really enjoyed it. And we got to have a variety of different lectures from different professors, and that made it quite enjoyable. It was a nice change of pace. Next, we have our clinical prevention and population class. Now, this class is really eye-opening to touch on the different ways, whether it's legislation or implementation, the different ways like people are in the population are affected by change of policy and different like health outcomes, weighing and arguing for different health outcomes throughout the semester and different health policy. It was really interesting, really fun class. Next, oral biology. Now this class, for me personally, I found it quite difficult, learning a lot about the developmental conditions, learning a lot about salivary production, odontogenesis, different things like that. We had to like be able to draw a lot of those things, and so that was quite interesting. And I thought oral biology was a fun class, especially learning about the developmental stuff, but I personally found it quite difficult with like the complicated words and things like that. Next, I have it like in all caps, is our host and defense course. This one was worth 8 credits. This class was tough, I'm not gonna lie. Last semester we had a course called Human Form and Function, which was worth like 13 credits or something, and that was more like anatomy and like human body based. A lot of macroscopic things, like lots of like identifying nerves, identifying muscles, learning the organ systems, things like that. Host and defense focused a lot on immunology, microbiome, like B cells, T cells, all the different stuff like that. Lots of diseases, lots of stuff that there are some things that were applicable to dentistry, but the majority of the things we learned in that class are not applicable to dentistry, and we go into the weeds on a lot of those really, really small things, really small bugs, really unique diseases. And so this class was the class that a lot of us were primarily studying for the majority of the semester. Next, we have practice management. This was super chill, an online module-based course. I enjoyed practice management. I felt like, did I learn how to manage practice? No. I think this is the first practice management course out of a sequence that we'll have throughout our time here in dental school. I think we pick up this course again in our D3 year as we start to learn more about running a practice, if that's something that we're interested in doing. Patient assessment and treatment planning, that's worth 2 credits. This class was actually a little bit harder than it seemed initially. Learning how to treatment plan effectively, I thought it would be very straightforward, but when you consider all the different factors that a patient might present with, this class was actually kind of a sleeper in my opinion. I really enjoyed the class. I think this was one of the most applicable courses we've had that we're going to be dealing with every day, and it's going to apply for the rest of our careers. So I really enjoyed PATP. Next, we have ethics. This class was mainly used to help prepare us for boards, the type of questions that we're going to be seeing on the dental boards, the ethical dilemmas you'll be placed into. And it's really good to know the different types of situations and the different ways you should respond and act based on your position in power as a leader and as a healthcare provider. A lot of people look up to you, so learning the different ethical situations and scenarios I enjoyed that class as well. Next, pathways exploration. We'll come over here. Pathways exploration. We got different lectures from each of the different specialists in their respective specialties in dentistry. And at the University of Utah, one of the really cool things about the program is we have the opportunity to join a pathway, meaning we get almost like an honor certificate in a specific field. So let's say you're interested in orthodontics, you can get into the ortho pathway and get extra training and extra lecture and extra instruction in that specific field. And it also can help, build relationships and networking within the specialty. Really enjoyed pathways. It was cool to learn about all the different options there are out there. Some of the most interesting pathways I thought were the para pathway. Oral radiology pathway was pretty cool because you'll use 3D printers and design implant guides and things like that. There's a practice management pathway. I'm pretty sure it was on the list, but I don't remember if we got a lecture about that. There's a public health pathway for those interested in the different types of scholarships you can get to help pay your way through dental. They'll help pay your way through dental school. And especially a lot of the big specialty pathways I found would be really helpful for students interested in those. I kind of touched on the clinic earlier in this, and I'm not gonna lie, even being an assistant before, I was really nervous going into my first few clinic sessions just because I didn't understand the workflow and the type of just being comfortable in the environment. New environments always can be a little bit uncomfortable, and so it was really good that they're getting us in the clinic. We're assisting the upperclassmen, we're assisting the docs, we're going on through rotations, we're scheduled at different rotation sites throughout the semester. So my first day in clinic, I was actually in the oral surgery rotation, so I had a really cool opportunity to see some interesting surgical extractions and bone grafts and things like that. It was a really cool experience. Next, we have Operative 2, a continuation on from Operative 1. Operative 2 was a little more intense than Operative 1. We basically only did, I don't think we did amalgams at all. Last semester we did more amalgams. Now we're entirely composite. Lots of class 1s, class 2s, class 3s. I don't think we did 4s yet, but 5s. Learning all of the different scenarios, locations of caries on different teeth. The practicals were a little tougher this semester. Operative, I love Operative personally. I think it's super fun. It's fun to get away from the didactics and break up the pace a little bit. One of the things I really like about Operative at the University of Utah is a lot of it's kind of self-paced. They give you an assignment, and in that class, you have a 4-hour window, right? 8 to noon. And if you get done with that assignment, a lot of people it takes most of the class, but say if you get done with that assignment in 3 hours instead of the 4, you're free to leave. You're done with the work that day. Of course, they encourage you to stay and practice, but it's nice if you can get working quick and get through your operative preps and get things checked off and approved, then you're welcome to go and study for other courses. And so I really tried to use that to my advantage by the end of the semester. Our last class, Cardiology, this was a 1 credit course. I really enjoyed Cardiology. It was taught by our dean, Dean Hume, and he's an absolute genius when it comes to the science behind Cardiology. And one of the cool things about his lectures was he would speak and tell all this information in stories. He didn't have notes prepared. He didn't have PowerPoints. He would just get up and speak and go off the dome. And it was really cool. It was really amazing to see him in his peak form and to hear him speak about one of the topics that he has dedicated a lot of his life to, because he's been a part of a lot of the Cardiology chapters and some of the textbooks and stuff that they may use at different dental schools. I don't know, but very fun course. Just to kind of give a overall impression of the semester, I would say that the spring or the second semester at the University of Utah is more challenging than the first semester. You're in way more classes. Our first semester, there was one big class, that Human Form and Function, that's worth so many credits. In this, you once again have a big class worth a lot of credits. However, you have so many other things to be worried about, so many other classes to be juggling at the same time, that I think this semester, I'd say it was a little bit harder than the first. It seems like they started us off in the kiddie pool and we're slowly ramping up into the deep end, ramping up that workload. And as we approach D2 fall, I think that's going to keep going and going, and then peak at D2 fall, and then hopefully subside and be on the downhill of difficulty. Keys to success. So the keys to success for your second semester in dental school are: 1, stay up to date on studying. Stay up to date on the lecture material, stay up to date on the Ankis. Just try and keep up with the pace of school. Our first about month and a half of this semester, we hit the ground absolutely running. We covered the majority of our oral bio in that first month and a half, on top of going over so much immunology and microbiology and host and defense. It really was a stressful time that first month. So my biggest recommendation is to try and hang in there, try and keep up with the pace, because it seemed like the semester was almost front loaded a little bit in terms of material. And then the second half of the semester was time for you to perform, but it was less material. So there was some time in there to study and to get prepared for the upcoming exams and things. However, there's so much material accumulated to that point, it would be hard to then go back and study everything. So finding your stride, finding your pace, I would say is the most important thing to succeed in your second semester of dental school. Another key to success, I would say, is really lean in to the bonds and the friendships and the different connections you've made in school at this point. Dental school is hard. It's a grind. No matter if you're a genius or not. I'm definitely not a genius. I had to work extremely hard. I know a lot of my classmates had to work extremely hard too. Really lean into those friendships, lean into those bonds, lean into those moments where you can truly, you can lean in and get through it together. I think dental school would be nearly impossible to do this alone, like completely isolated. You need that community. It's hard, you're busy, and having other people to go through that with you makes it lightens the load on everybody. And that's something I really appreciate. I'm really grateful for all my friends within my class, and especially my wife, especially her, to help me get through and to help support each other through the difficult times that dental school will bring. Other tips I have for your second semester of dental school: staying on top of things, lean into your friendships. Third thing I would say is start to express interest in whether it's you're interested in a specialty or interested in a type of business model of dentistry. There's a lot of opportunities in dental school to start building relationships with faculty, start shadowing during your free hours in clinic. There's a lot of time, there's a lot of ways you can start to become more involved. You can start to see more of dentistry and see more of what you're interested in. And that's one of the things I really appreciate about them getting us into clinic at an early time is that I'm able to go and shadow some of the periodontal or oral surgery procedures that I'm interested in, and that's really cool, and I really appreciate that. And it's really cool to have the opportunity to meet those faculty. So definitely take advantage and utilize those resources as much as you can. Other things, let's see, that would be helpful. Maybe start buying more scrubs. I have like 6 pairs of scrubs, and so I have 1 extra because Monday through Friday there's 5, 1 extra in case I get behind the laundry or something. The scrubs get beat up in operative. Like I just got home from school, my scrubs are starting to have strings coming off them, and they're covered in dust and grime from operative and clinic. So by your second semester, you may want to consider that. Other things are try and remember that there's life outside of school. Try to enjoy the moments you have that are outside of dentistry, that are outside of dental school, and enjoy life. One of the amazing things about being in Utah, and I feel so blessed to have the opportunity to go skiing in the winter. For those that don't know, Utah, we get a lot of snow, and there's great skiing here. And in the spring especially, like January to April, there's phenomenal skiing. And so almost every weekend my wife and I would go up and just get away, just see, whether it was just for a few hours, just go up and do a few runs, get up into nature, get up into the mountains, enjoy life, go to the gym, go on runs, just enjoy life outside of school. Remember, there's more to it than just books and studying and whatnot. And yeah, that's all I have prepared for this video. I really appreciate you watching. I kind of took a while to get to this topic, so my apologies for that, but leave a like if you enjoyed, subscribe, and stay tuned for more videos. I hope you have a great rest of your day. We'll see ya.